Hey everybody, it's Shannon with Sparkle and Shine Health and Fitness, and I'm just jumping on quickly to share with you guys the first in my Germbuster series. We've been talking the last couple weeks about healthy habits, our drinking water, our getting enough sleep. We've talked about scheduling those healthy habits, using our calendars and planners to get them in, to do meal planning, to do meal prepping, get all those healthy habits in. And now I'm excited to share with you this week some common illnesses. This is our Germbuster series. And the first one I decided to do tonight is on influenza, because it is still influenza season. And technically they say October through March is influenza season, and we're still in March, unfortunately. So here in Nebraska, there is influenza still going around. Initially there was a lot of influenza A, and now it's kind of switching to influenza B, and we're seeing a second round of influenza B going around in the state. And so let's talk a little bit about what influenza is, what the symptoms are, so that you can be informed. So when you see these symptoms, you know what's maybe going on and how to treat it, what to do, help your family from getting sick. And so the first thing that we're going to talk about is the signs and symptoms of influenza. And so what exactly are some of the signs and symptoms of influenza? Fever, usually a high fever, but you don't have to run a fever. Body aches, headaches, cough, a bad cough usually, and that's how it's spread. And there can be lots of other symptoms. There could be sore throat. There can be nausea and vomiting. It's not as common, but there can be that also. So it's just important to recognize those symptoms right away. And then how do you diagnose it? Well, that is diagnosed by a doctor, and they can do a nasal swab. It's not real fun. They stick this swab up your nose, but they can test it really quickly and tell if you have influenza or not. They can tell if it's A or B too. And so if you are diagnosed with influenza, the doctor can actually prescribe an antiviral for you. It's a prescription medication. It's recommended to have it in the first 2 days of symptoms, but there are exceptions that it can be further out past that and they still give it to you, but that is the physician's call. Those antivirals will make the symptoms not so severe, make the symptoms not last as long. You usually get over the influenza a couple days quicker than if you don't have the antivirals. And so it's always good to get on that right away, get to the doctor if you think you have those symptoms. So remember those symptoms, what to watch for. The elderly can get the sickest with it. Anybody that's immunocompromised, kiddos, really little kiddos can get really sick with it. So just being aware what those are and don't letting your family spread it everywhere and get sick. The next thing we're going to talk about is preventing the spread of influenza. So influenza is spread through the air in droplet form. So it actually can spread through the air up 4 to 6 feet in the air. So just talking, coughing, sneezing, those are all forms that it spread through the air. And you can be 6 foot away from somebody and spread it to them. The other crazy part about influenza is I might be healthy today, not sick today, and come down with influenza tomorrow, but I can be talking to somebody today and spreading those droplets through the air, and I'm actually contagious. So another reason, the next thing to share is about getting a flu shot. I know a lot of people don't like to get shots. They don't think the flu shots work. I've had one every year since I've been in healthcare, and I'm not going to tell you how many years that is. It's a long time. And I've never got sick from it. You really technically can't get sick from the flu shot because it's not a live virus. But you can, maybe you're going to get sick anyway and you got the flu shot, so you might come down with something, but it's not technically from the flu shot. So it's really important to help prevent the spread of influenza by getting a flu shot. Pretty much anyone 6 months of age and up, it is recommended, even if you're pregnant. And so that helps prevent the spread. Now, I could get an influenza shot and still technically come down with the flu. And the reason why is because when they make the influenza vaccine, it only covers a few strains, the strains that they think are going to be the most prevalent that year. But sometimes some other strains pop up and are, come throughout the area. And so you might get another strain of influenza, even though you've had the influenza shot. But usually, since you've got the flu shot, you don't get as sick. You get over it a lot quicker. So getting the flu shot still helps. So don't be afraid to get out there. Usually, the beginning of October is when the CDC starts recommending everybody get their flu shots, and that will cover you for the whole flu season, all the way through March, April, however long it lasts. Hopefully, we're starting to see the end of that. The other thing to help prevent the spread of influenza, we talked about it spread through droplets in the air, so covering your nose with a Kleenex when you sneeze, throwing the Kleenex away and washing your hands. When you cough, cough into your sleeve, not into your hand, and then touching surfaces, because then you're just spreading the germs. If you cough into your hand, then wash your hands. Use antiseptic gels if you don't have soap and water where you're at. So coughing into sleeves, coughing into Kleenexes, sneezing into Kleenexes, all those things help prevent the spread of it. The next thing is washing hands. Like I said, wash, wash, wash. Have everybody wash their hands. Anytime you touch surfaces, anytime you go shopping at grocery stores and you touch carts, right? All those things are full of germs. So wash your hands. Have your kiddos wash your hands. Constantly wash your hands. And then the last thing is just disinfecting surfaces. Getting those Clorox sprays and spraying surfaces off, cleaning them off. Anything the kids are, runny noses, they're touching their noses and touching surfaces, wiping stuff off, having them wash their hands. So those are the biggest things. So I just wanted to jump on briefly and share just some tidbits of influenza with you. Hopefully we're seeing the decline of influenza, but it is still out there throughout the state. Those are just my tips for tonight on influenza. All these things that I've told you are from CDC guidelines, the Center for Disease Control and Prevention. Those are the guidelines that we follow at hospitals, like where I work, and this is the area that I work in, is infection control. And so I'm just simply sharing those little things with you that we do to help prevent the spread. And I hope you all have a healthy rest of the month. I will talk to you tomorrow on a new subject. Thanks.